Peeing your pants as an adult is a red flag. No adult should be peeing their pants. I mean, come on, we're all potty trained, but the reality is that so many women pee their pants. This happens when they cough, when they sneeze, when they jump on a trampoline, or maybe when they go for runs. And a lot of times they're just conditioned to be like, okay, this is what happens to me after I have kids. Maybe some of them haven't even had kids, and yet this is still happening to them. So why is it such a red flag to pee your pants when you are an adult? Let me tell you. Okay, I'm Dr. Allison Feldt. I'm a pelvic expert physical therapist, and it is so important that you don't pee your pants. If you're peeing your pants, it essentially means that your core is not working for you, and it is doing you a disservice because it's not keeping your pants dry. The pelvic floor is the bottom of your core. The other key aspects of your core are your diaphragm that sits underneath your rib cage, your abdominal muscles, and then your booty muscles and your low back muscles. These are all important aspects of the core itself. So if you're peeing your pants, essentially your core is not working for you. It's working against you. And so why is this such a red flag? Because a lot of reasons why women end up with hip pain, with knee pain, with low back pain, which spirals them on to get injections in certain joints of whether that's cortisone or other, stimulations to help the joint pain, which then often leads down a path of surgeries. They might get one knee done and the opposite hip goes out. And these are just the pain patterns that happen. And it all leads back to the fact that their core isn't working for them. I wrote a book called Restore Your Body After Kids, The Secret to Avoid Achy Joints and Peeing Your Pants as You Age. And the reason I wrote that book is because I want people to know why peeing their pants essentially means your core can't work, which essentially means that you can wear your joints out a lot faster than just someone who has like a joint injury per se. So this is really important stuff. With the core being such an essential force absorber, so something that should absorb the forces so our joints don't take up a lot of that pressure, which can lead to arthritis and the joints breaking down, then as long as the core is strong, it can do its job as the force absorber. I want you to imagine that the pelvic floor, this bottom muscle, is like a spring, okay? It's this little spring that should contract, it should relax, and it should overstretch. Every time that your foot hits the ground, the pelvic floor should recoil and come back up. And that should happen every time your foot hits the ground. When that's happening and you get this nice little recoil of the pelvic floor, then you get this shock absorption from the bottom of your core. And when that shock absorption happens, it helps take the pressure in the shocks off the joints. So then you can avoid things like chronic hip pain, SI joint pain, or just general low back pain. We don't want those pains in our lives. We want to live pain-free lives. And so our bladder leaking is the first sign to tell us that the pelvic floor isn't working for you. And now most people think that they just have to go bust out 100 and 1,000 Kegels a day to make it so their pelvic floor starts working for them. That could not be farther from the truth. And so I don't want you to watch this video and then go start doing 100 Kegels, 1,000 Kegels a day. That's going to be super detrimental to you. What the reason is that you don't have that shock absorption is oftentimes because the pelvic floor is frozen in a tightened position. And we want to help give it length so that every time your foot hits the ground, you can contract it and it can contract on its own. This isn't something that you have to volitionally think about or control on your own. This is a natural life reaction. We don't actually have to think about not peeing our pants. We just need the muscles to do their job so that we don't pee our pants, okay? Super easy. Okay, once we get the pelvic floor working. So how do we get the pelvic floor working without Kegels? Let me tell you, most people are stuck in a semi-tightened position of the pelvic floor muscle. And so it becomes frozen in this position. And so they don't get this nice little spring and slinky effect of shock absorption. We need to restore that. So one of the best things that you can do to restore that is to start getting range of motion of your pelvic floor. Now, working with a pelvic expert physical therapist can be absolutely essential in restoring blood flow to this muscle, to help unfreeze these muscles, to really bring health back to the pelvic floor. And you do that without the use of Kegels, okay? So any devices that create a Kegel or that are telling you that you need to squeeze around, really that's the opposite of what we want to be doing. We want to be opening up the pelvic floor, opening up these muscles so that the blood can flow, these tissues can change to a nice healthy texture. When the pelvic floor is semi-contracted and frozen, it doesn't get the blood flow it needs. So it becomes a dehydrated muscle. A lot of times what the texture of this muscle feels like is beef jerky. Our goal for getting range of motion to this muscle is to turn that muscle to a nice, juicy chicken breast or healthy muscle texture that has good blood flow, has good ability to contract and relax and overstretch. The healthiest core muscles are the ones that can eccentrically elongate the most. So if your pelvic floor has good range of motion in that direction, in that opening direction, then you're going to have amazing shock absorption. So you might be like, no way, that's not true. I just need to squeeze, squeeze, squeeze so I kink off my pee. No, if you're stuck here, you don't have much room to squeeze much further, so there's not a lot to kink off. A lot of times what happens is if you imagine that your pelvic floor, the bottom of the core, is a bowl, and inside that bowl, we have a grape floating in that bowl. The tighter the bowl, the more it's going to squeeze the grape down, pushing the bladder down and out, creating leakage. The more relaxed and open the bowl, the easier it is for the bladder to float and be free. All right, so we need that muscle to open up. This also makes things like sexual intimacy and penetration much better for the person and the partner. And you might think, but like, I want to be tight. A tight muscle, a dehydrated muscle that doesn't have good blood flow, it doesn't feel good for anybody. So the more eccentric control and blood flow you have to this muscle, the better it's going to feel for both parties. So I just want to like nip that in the bud real quick, because a lot of people ask me that when I give talks, like, I want this to feel good for my partner, and so how are you telling me to get looser? Is that going to make me feel better? And so the reality is like, we want these muscles to be hydrated and feel really good. And actually, when they're hydrated and healthy and can open a lot better, they have a lot better recoil and can get tighter when they're meant to contract naturally. That's that shock absorption that we want to train. So if you are peeing your pants, you work on getting that range of motion and that blood flow flowing to the pelvic floor. That is going to restore the pelvic floor health and pelvic floor muscles much better than any device that causes a contraction, a squeeze, like an Emsella device that just causes this contraction to happen. And so, yeah, it might temporarily work, but you're going to, again, freeze the pelvic floor. We need to work on opening the pelvic floor and getting that range of motion. Start with working with a pelvic expert physical therapist who can do hands-on manipulation to give you that range of motion of the pelvic floor, restore the health of that muscle, and then once you get that health restored, you can reinforce that with things like breathing. So on my YouTube channel, there is a million exercises about how to breathe, but simply put, you could just do a hand on the chest, a hand on the belly, take a nice deep breath into the hand on the belly, exhale and let it go. When you inhale into the hand on the belly, I want you to imagine that your vagina or your anus is opening. And then as you exhale, you get some natural recoil. And this is simply the answer to getting range of motion of your pelvic floor and stopping the cycle of constantly peeing your pants. I'm Dr. Allison Feldt. I own Body Motion Physical Therapy. If you are peeing your pants as an adult, having joint replacements and having injections and being the little old ladies in nursing homes sitting in their wheelchairs with endless joint replacements in their diapers, getting skin breakdown. So it is my passion to tell you to keep your pants dry, get your pants dry, because fly out to Body Motion in Edmonds, Washington. We also have a location in Poulsbo, Washington, and we can help you in 5 days get your pants dry so you no longer pee your pants. And we will give you some really good pelvic floor health and tips and a lot of hands-on work to free up your pelvic floor and get your core function functioning in such a better space. This is the best investment, and it's cheaper than buying diapers for your rest of your life and or taking bladder medications that have endless side effects and or thinking about going down the Botox route for your pelvic floor muscles and or your bladder. So I don't wish that upon anyone. If we fix the natural root cause of why people are peeing their pants and why adults are peeing their pants, not only are we going to save the endless funds on diapers, but we will save ourselves from being the soliloquy of conditions that you are preventing is quite astronomical. So let's change the health of women in America and actually tell people how important it is that you don't pee your pants. Most women pee their pants. So that just means that there's other things going on, like they're wearing out their joints. So let's prevent that cycle. I wish you all the best in your healing. Drop me a comment below or shoot me a DM or an email, and I cannot wait to be in touch. Support at bodymotionpt.com. I'm Dr. Allison Feldt, and we cannot wait to serve you. And we can't wait to help you live your best life. Take out the serve.